everyone, this is Kitty Affirmations here, and I'm here to do a video. And I'm gonna see if I could try to make this video short if I can. Alright, so this video, I'm getting back into the letrozole. I'm gonna start getting more into information. I did explain what it does, what effects, that is the normal effects, to non-normal, and you speak to your doctor. But I'm actually going to get more into it because the last time I did a video of it was like 2 months ago, saying I was on it for 4 months and 1 week. So we're looking at least for me now, 6 months, probably a couple weeks. I can't kind of put like this, like that number I'm looking for. But I know it's been 6 months already. Here we are with a couple weeks. That's my guess. So I'm going to get into more information of letrozole does work for different kind of cancers. But I am going to explain what is the use of letrozole 2.5. The use for that is also treating breast cancer. It can also prevent breast cancer from coming back. It's mainly prescribed for women who's been through menopause and have types of cancer called hormones independence breast cancer. And that's not made for breast cancer. It's also made, like I said on there, for menopause. Menopause means hysterectomy. Goes through your ovaries, of course. Which these also are made for people that went through ovarian cancer. I could probably be saying it wrong. I have a different accent, guys. I'm sorry. But it does also treat that type of cancer. And then I'm just going to go ahead and jump to the side effects to the letrozole of 2.5. The main side effects, well, I can't say main, I'm just going to say side effects, meaning it could be any type of side effects. Hot flashes, hair loss, joint, bone, muscle pain. That could be anywhere from your body, because my experience, it's been going through all over my body, my legs, my back. It's this pill does cause pain. And that's the bad thing, because sometimes you have to ask your doctor, like, hey, can I get a pain medication? And that's why they gave me gabapentin. Gabapentin is made for different titles of meaning for your body. They have, yes, depression, anxiety, stuff like that with gabapentin. But they also, alone only is made for a pain pill. This, so y'all guys are clear on that. Alright, so tiredness, yes, that causes a lot of tiredness. That has been my common one too. My body is just very tired. I don't sometimes want to do anything. I get some days like that. And I'm going to jump back into the beginning. Hot flashes. Hot flashes is the main effect, and you will get a lot of that. You make sure you try to stay cool, have AC. That's a good thing when winter comes. You don't have to worry so much. Hair loss, there has not been any signs of me losing a lot of hair. From the beginning of my stage of what I had, which was the cancer, I was losing a lot of hair before I took the letrozole. That was my experience, but taking this medication, losing your hair, I have not, and I'm surprised on that. Unusual sweating, that happens to me sometimes. Yes, you will have unusual sweating sometimes if you're not in a cool atmosphere. That is definitely going to rise your temperature up big time. Nauseated, nausea, not really. I haven't. Diarrhea, no. Dizziness, it odds because a lot of pills like this, taking letrozole, mostly it does cause a little dizziness. I have been through a lot of that stage, and I know I have a lot of dizziness on other stuff that's on me right now because I'm still going through a lot of health issues, uh, especially more in my head right now, and plus my hands, which y'all guys can see. I'm going through some pain as is, so that's like added on to that. But trouble sleeping may occur. When I first started these medications, it will start that way. I had issues literally sleeping. I'm not going to kid on y'all guys. You know, not everybody will agree this will work for y'all guys. Because some people will go to the doctor and say, hey, I need a sleeping medication. Me, I just take a melatonin. It works for me. I'm not saying it will work for anybody else out here. Some people can take melatonin and it will work. Not everybody. Okay. So, that's what I take. So, meaning y'all guys would definitely need a sleeping medication. Especially if y'all guys have insomnia. Insomnia mixing with these pills, kind of having trouble sleeping, is definitely going to be a big plus because, you know, y'all will definitely have to take medication, and I will advise people ask your doctor if you're taking letrozole 2.5. Okay, so now we're going to hit into what are the benefits of letrozole. The benefits of letrozole lowers the level of the female sex hormone estrogen in the body. And that's why we can't take certain menopause medication. Some people don't listen, that I heard, and they do it anyways. But I prefer to look out after my own health and be safe than sorry. So I will recommend not to, unless until your doctor tells you is okay. The estrogen stimulates some breast cancers to grow. These breast cancers are called hormone sensitive or hormones receptive positive. Letrozole can stop or slow the growth of these cancers. So that's the benefits of letrozole. Now, I'm just getting into like the main. Alright, so since I had, which I'm going to get personal again, the ovarian cancer, because I did not explain this on my channel, what kind of cancer I had until recently, until this video. The question on here, what does letro do to your ovaries? Okay, by generating the FSH, okay, not a lot of people will know what that means. The ovaries are stimulated to grow more follicles. Letrozole boosts its growth and release of eggs in a woman who are anovatoria, I don't know that word, or not overlean, and can cause supervolation in a woman who are already able to ovulate. In both cases, it increases chances of natural constipation. I mean, I don't know if y'all guys want to know that, but that's what does the letro do to your ovaries. But that's if y'all guys have your own ovaries already. That's what that's for people that has the ovaries. I don't want y'all guys to get confused there. Okay, now the worst side effects, which is very rare, and I will recommend tell your doctor. Continue severe nervousness, dizziness or lightheaded, fast heartbeat, heart attack, pain in chest, groin, legs, especially in the caves, severe and sudden unexplained trouble breathing, severe sudden headache, slur speech. Please tell your doctor if you go through any of those. Those are very dangerous. Alright. Now, this is actually a good question, which I did say in my video. Does letrozole make you gain your weight? Weight gain is one of occasionally size effects that can occur when taking letrozole. But if you're finding it difficult to control, then it may be worth getting in touch with your doctor to let them know. But they did not say yes or no. But I know this answer. Letrozole does gain your weight. So you start gaining your weight very slow. And how I know this, because I've been seeing my doctors and I noticed I have been gaining my weight like so slow. But my weight is pretty good lately. So, God bless on that. I'm happy I'm gaining my weight back. Alright. Now, Alright, so does letrozole cause hair loss? Okay. On that question, it can actually hair thinning your hair, which that is true in some degrees. And that's why my hair, when I noticed it has got to that point, when I was saying in the beginning, I did lose a lot of hair. But as taking this pill, my hair has been thin, and I do recommend people to use this product, biotin, which I'm sure a lot of people heard of that. You could take the medication, but in my degrees, I don't, because I don't want to be mixing certain pills with letrozole. I'm kind of being more cautious with myself taking this medication, especially not trying to take all these type of medications, because I'm on practically like I had to ask permission, for certain medications. I can't just be like anybody, hey, let's go in the cabinet and grab anything you like. No, it does not work that way. If people want to take the risk of their health, I'm not judging nobody. That's on you. But as myself, and give an opinion to others, I will not be mixing any type of medication. The only thing I will recommend, which they have biotin shampoo and conditioner, they have oils to put in your hair, and lately that has been working for me. So I have been using that. So yes, letrozole does thin your hair a little bit, so I do recommend people using hair growth. Alright, now, I think at most of this that I have explained what letrozole does, some of these questions, what's the side effects, what I'm going to do here is go back to alright, so there is another thing. There is a question called, what are the risks of taking letrozole? Alright, so the risk on that, the common side effects can be like menopause symptoms and included hot flashes, difficult sleeping, as I was saying, tiredness, and there is another one called low mood. You will be experiencing low mood, like you just in your own myself, like, I'm just going to prescribe, like, not prescribe, like, give it an example, like, I just want to be in my own little cave. You know, you have these different moods with this medication sometimes. So your low mood kind of like odds with things. And yeah, so this is why I'm the way how I am right now too. This medication got me in these certain moods. And it's like, oh my god, like you feel like you're down, or you just want to be alone, or you know, you're just like eh. You know, like, you know. I just don't want nobody to bother me sometimes. And that's sometimes how my mood is. This mood could be any type of mood. It could be from, you know, just not from, you know, and like be alone, like you in your little bubble. But sometimes you tend to get a little cranky still. I'm going to admit it to y'all guys. You will get cranky. Because this medication, with the experience I have already been going through it, this is like insane. Like, okay, you know, I've been on this medication, I think, in March of this year. So, yeah. And it's already like 6 months and a couple weeks I'm taking. You count from starting sometime in March. So, yeah, it does hit hard, but there is no certain symptoms that, you know, has not done anything. I mean, it's very uncommon. I want to say that people will get these certain side effects, but they really won't. But then again, it depends on the person's immune system inside. Yes, and there has been some people heart race will start beating pretty fast. That has happened, which that is true. This, like I said, it depends on the person. But when your heart races like that, yeah, go to the emergency room or go see your doctor. But yeah, I had to let y'all guys know with the mood part. Side effects usually improves after a few months, or your body gets used to the medication. And sometimes this will take a couple weeks, couple months, couple years to actually start kicking in more longer into your system. So, your another thing, your doctor will monitor your blood pressure, cholesterol levels, and bones density during your treatment. That's what they do. And they do your bones for a couple of reasons, because since it causes a lot of pain, you know, exactly. So that's why they have to do that. So as I was saying, to question when do letrozole starts, the side effect starts. Like I said, it takes the first few weeks after starting letrozole. It commonly occurs when changing from hormone therapy to another. This may also be due to vaginal dryness if the bleeding continues for then a few days. Tell your specialist. But sometimes it takes longer into your system. Normally it does that. Alright, so I'm just going to go ahead. Alright, I'm going to make this the last one. The question is here, is it better to take letrozole in the morning or at night? Now, I kind of had a lot of issues from the beginning from that. My doctors was really strict on me at first. Oh, well, you had to take it. You can't be messing with no cancer pill. You know what I mean? And I could not sleep because it was driving me nuts. I had to literally set my alarm every day just to take it, like, through that 24 hours of a day. And it just was driving me nuts. And I got to the point with them, like, you know what? I'm not going to listen. The pill stays in your guys' system at least 10 days. That is 250 hours. Okay, so even if you're late over 24 hours, it's still in your system. So I've been taking mine very odd hours. I just don't care. I sleep how I want. So please don't stress out over that. I mean, I went through it. It was not fun, and I was suffering like that for months. I mean, literally for months. I could not sleep correctly. So take it how you want, and please, like, if a person says take it at 8 o'clock in the morning, then you take it at 8 o'clock in the morning the next day. But even if you're over 8 o'clock in the morning, if you wake up at 2 o'clock in the afternoon, per se, this is example, guys, you're fine because it's still in your system. I just want to give y'all guys that heads up because that's how I do mines. Alright, so I think I discussed everything about letrozole here as much as I can. And if I did miss anything, I will post it up in my other videos. And the updates with the letrozole with me. So far, everything is still going good. I still go through my common side effects on it. And nothing has changed. I think when, like, last month, I was feeling pain issues. That's why they had to do a CT again on me, and thank God nothing happened, so amen on that. So, but yeah, I'm just letting y'all guys know my end of my updates here. Everything is still good, everything is still the same, there is nothing going on, nothing has changed. Everything is still the same as my other recent videos that I do as updates every couple months. And now I'm trying to make it a little bit more longer. Even if it's 6 months, I will definitely do more updates on the letrozole then. So anyways, guys, if y'all guys like this video, give me a thumbs up. Subscribe button down below so you guys be notified. And no, there's no affirmations on this video. It definitely went very long. So other than that, guys, y'all always take care and always smile and always cherish the day. Do not let nobody put you down, put your vibes, your energy vibes down. Always smile. Yes, this life may not be beautiful or a fairy tale, but you know what, guys, I'm being real. Just smile. And if people don't like your smile, they're negative. Move on and go to somebody else that actually is there for you no matter what. So other than that, guys, I'm going to go ahead and end it here. So y'all guys take care and God bless and peace out.